Okay, so a couple of business things here. I'm going to share my screen. So if you are not familiar with Strengthening the Heartland, Strengthening the Heartland is a partnership with SDSU, NDSU, and they have been doing a string of virtual webinars on a lot of different topics that are substance abuse or mental health related. They're currently looking for ideas for webinars for their next series. If you do not have Dr. Ramsey Senior's information, because you can see if I click, give us your input, all they're asking is just to email her. So I'm going to put her email address in the chat. And simply again, you know, for your population, for groups you're working with, for specific needs, are there any, like you see, are there any wellness needs or topics that you'd like to see be covered that they could try to bring in speakers for? So if you have not checked out their YouTube page, I will also post that. Their YouTube page has all previous webinars that have been recorded up there, and they're very easy to access. So that's really wonderful. So you can see maybe what they already have covered as far as topics or different populations or needs. And so being able to kind of know what's already available and looking at some of those gaps that you'd really like to see covered, please feel free to reach out to Dr. Ramsey Senior and give her any of your ideas. So both her email as well as their YouTube page is currently listed there. Any questions, you guys, about Strengthening the Heartland that maybe I could do my best to answer or cover? Awesome. May is Mental Health Awareness Month. One of the things that I wanted to get on your calendars now is May 10th will be the proclamation from the city. So the mayor will be doing the mayoral proclamation for Mental Health Awareness Month at the May 10th City Council meeting. I do have to have a list of those who are wanting to attend on behalf of the coalition to accept that proclamation. So if you could please email me if you are interested in attending, so I could get that to Andy, that would be great. Just go ahead and send me an email if any of your entities would like to attend. We would be there on the docket for the city council meeting right away. Mayor Oak would do the proclamation, and we'd be standing in front of the audience to accept that proclamation. Typically what they do as well is they'll record that, and Angie will actually cut it into a video of just the proclamation itself, and we'll be able to share that in different media opportunities also. So that's really exciting. The city is willing to do that. Any other entities kind of have some stuff going on for Mental Health Awareness Month that you'd like to share with everybody?
This is Karen. I'll share. So the hospital applied for a WorkWell mental health grant through NAMI, and we received that. So May, we are doing stigma-free workplace education for all of our staff. NAMI is gracious enough to actually come up 6 different times over a 3-day span to hit hopefully the majority of our team, and then we'll also be able to record it and people can watch the training online as well. So, and then we're kicking off our recharge room, and we'll have on our internal, like intranet, our info hub, all sorts of different mental health resources available for staff as well. So pretty excited about that.
Hey, Karen, that's awesome. You know, my first thought is there be any interest, you know, on behalf of you guys for like running a newspaper article that I could help you write for that?
I think actually Julia is already on that.
That's
So,
awesome.
yep, once we kind of have all of the puzzle pieces put together, I think we were going to promote it as well. Yes.
Yeah, that's fantastic. It'd be great. I don't know what your thoughts are. If there'd be any opportunity to, if you could ask Julie to maybe include, like if other businesses were interested in having NAMI come do some of those presentations, is there a way to include that NAMI contact information in there too? That'd be fantastic.
Sure. Sure.
That's wonderful, Karen. Good job.
Thanks.
Heidi, I see you raising your hand.
Yes, I'm putting into the chat our link on our website. In May, we'll have 2 different mental health trainings that, again, Dodie will come down and do for us. May 4th is the mental health first aid, which is the 8-hour course that will be out at Dakota Nature Park. And we have about 3 spots left for that one. And then May 12th will be the QPR. So that's the hour-long one, and that will be held at the library. And we probably have about 10 spots for that one. And those are free. You can just go to our website to that link. Feel free to share it with anyone else as well.
Very awesome. Thanks for those, Heidi. We can help, Chrissy and I can help work to try to get those out by social media for Mental Health Awareness Month as well. Any other, sorry guys, any other entities doing anything specifically for Mental Health Awareness Month you'd like to share? So a couple of things we'll be doing here at Avera Behavioral Health is we'll actually be collaborating with the SDSU Public Health Department. One thing that we are hoping to kind of have ready here by the end of the week is a little bit of a social media prevention package that will be available to any business where you can share different graphics or mental health awareness components on your social media. So Dr. Hunt and Kirsty and myself will be working on that and hoping to get that out to you guys here within the next end of the week, or hopefully at the beginning of next week, just to make it really easy to continue to share that awareness. Another thing you'll see on some of our social media pages, as well as maybe some email strings, things like that for Mental Health Awareness Month. Avera Behavioral Health will be collaborating with Clean Slate to do some mental health awareness sweatshirts and t-shirts again, that just kind of, again, share those messaging of mental health matters. The semicolon, which is a large visual in regards to that mental health awareness piece. So working with some entities to get that out. So you'll see that will be available. Some very nice green attire for the Mental Health Awareness Month colors. So we're really excited about that. And then you'll see some information for the end of the month of May, where we'll also be hosting free signage materials, as well as just time to be able to come and make different signage in regards to mental health awareness to post in front of your business, to again just continue to really put in front that messaging in front of our community members that mental health is just as equally as important as our physical health, and there are a lot of supports we have in our community to support people right now. So don't be surprised as you kind of see that information coming out within the next week to 2 weeks about those events Avera Behavioral Health will be hosting in coordination with SDSU Public Health Department. So always excited. Dr. Hunt's willing to collaborate on a lot of those opportunities. For the, go ahead.
Nikki, I had one question. I didn't know if we were going to host booths at farmers market. I don't know if you heard back on that.
I haven't heard back yet. I'm hoping to at least get some more information before May to know if that's an opportunity. One of the things Dr. Hunt is asking about, so there's a group of different entities, and we haven't really just shared more information because we're trying to see what it would look like through the farmers market. But almost kind of this idea of what United Way does with downtown at sundown is this rolling weekly hosted opportunity where if there's a set spot at farmers market that we could host, but different entities become able to sign up for a different Saturday, where you're not necessarily responsible for the whole summer and fall of farmers market, but you can be maybe responsible for 1 or 2 Saturdays. We're trying to kind of coordinate with the farmers market to see how we could do that. So I'm hoping to get more information from them and get that to you guys to see just who would all be interested, because I know there's been a lot of entities who've expressed interest, and we want to make sure everyone has an opportunity to participate if this is an option. Trying to get some more info and can let you know too, Dr. Hunt. So again, I know there's been some who've kind of joined later. So the biggest business thing is the proclamation be May 10th for Mental Health Awareness Month. If you would like to attend, if you could email me and let me know. I do have to have a list of those that are going to attend to Angie. So thanks for getting that to me. Please feel free to let people know if they want to participate. Just to send me, all I need is a name to get to Angie so they know I'll be there. Otherwise, we'll go ahead and just kind of do updates. So again, just introducing yourself, who you're representing, what entity you're representing today, maybe some things that are new or something you're needing, and how can the coalition help. Jacqueline, the proclamation will be right away at 5:30. Will be one of the first things after they accept the agenda for the city council in the past minutes. The proclamations will be the first thing on the docket. So first up would be Allie.
Hi, I have food in my mouth. So sorry. We have our open house tomorrow. So if anyone would like to come over and see our new space, we are having an open house from 4:30 to 5:30 with a ribbon cutting at 4:45. And so I'd invite anyone who wants to come over and check out our new space to come visit us tomorrow. And then that's kind of like, I guess, what's happening in my head right now. But we did recently do a look at our applicants, and we actually saw that we have about 60% that are that identify a unique need on their application that does impact their mental health or has potential to impact their mental health. And so that was just like a pretty big eye opener for us. It's over half the kids in our program. And so, yeah, so we're doing what we can to support them, and we'll keep at it. I think that's all I had.
Awesome. Amy.
Hello. I'll turn my video on here quick. Maybe. Hello, everyone. Brookings Behavioral Health and Wellness. We are keeping busy with everything here. Wrapping up school-based services in May here, but continuing to provide those services, whether they're home-based or at the club or in the office throughout the summer. Adding on a couple new staff members, waiting on some final offer letters for that before we announce anything further on that, but just trucking away here, keeping busy.
Sorry, you guys, I should have asked if there were any questions for Allie, but any questions for Allie or Amy at all, you guys? Christine.
Hello. So I'm from Child Protection. Maybe one of the biggest things that are happening for our local office is that we are moving forward with the safety plan group through Grace Point. We actually have a training on April 27th. And so the safety plan is basically when we're involved with families that their children have been displaced. We work really hard to have the children be reunited with mom and dad in a safe environment. And part of that component is having a support system. And a lot of the clients we work with have very limited support systems. And so we have what's called a safety plan providers. And these providers are going to be volunteers with background checks, but kind of surrounding mom and dad with that support that's needed. So being part of the community, being able to raise their children. And so we're putting this into place, and that training is going to be occurring. So I'm hoping they did a pilot in Huron that was fairly successful, and they're trying to do it in Aberdeen, and then it kind of trickled to Brookings, and our community, especially through Grace Point, we just had a huge embrace with that. And so I'm looking really forward to that. Also, this month is Child Abuse and Neglect Awareness Month. So if you can spread, we're not immune to it. Child abuse absolutely occurs in our community. The local office here in Brookings, and keeping in mind, I do cover we have a total of 5 counties of jurisdiction that we range around 30 to 40 children that are displaced from their moms and dads or under the legal custody of the state. And we also do work with a few families that children are still intact with their families and working with them. So keep those kiddos in mind, the families in mind during our Child Abuse and Neglect Awareness Month. I think that's all, Nikki, unless you want to add a few more things from Child Protection team or anything like that.
I will add that throughout the state of South Dakota, there is a competition for communities to see who can train the most community members on adverse childhood experiences and resiliency. There are a couple of virtual options left. And so information on those trainings, which are about hour-long trainings, are available on the United Way calendar. So if you would be willing to help share those trainings, maybe in your business and your population you serve, any social media opportunities you have, we would really like to continue to share that information about the training to see if we can get more people signed up. We have had some pretty successful trainings so far in April, and Heidi and I are really hoping we can continue to get that number up. So we can really celebrate just continuing to increase that awareness about trauma and the impacts of trauma. So again, all that is on the United Way calendar. Any questions for Christine at all, you guys? If we're here, Dave, we would love to hear from you.
Hi, sorry I was late. Well, let's see, what do we got going on? Phase 2, we're in the middle of at our jail here. That's our admin portion, our medical portion, and our programs area. This portion of phase 2 will have our 2 safe rooms in it, and we're excited to get those up and going. Once we do have everything up and going and everybody settled in, I'll send out for some openings that we'll have, get everybody to come take a tour and see what we're going to offer in our phase 2 of our new facility here. Talking with Karen on a couple things, and I'll get with her some more and get some more information put together and everything, and on how we can best utilize those. and bring those in on the mental health side here.
Awesome. Any questions for Dave, you guys? Okay. Deb.
Deputy Bates, the Brookings School District, mental health continues to be a concern for all of us that work with the Brookings School District. I try to post the opportunities or share the opportunities that I hear from each of you, and we meet on a monthly basis with the school district so that those within the district have opportunities to attend. I did attend the inclusivity program that was offered last week, which was very interesting, and we got a lot of community feedback at that as well. Michelle Vanderwoord is in the process of putting together professional development opportunities for summer. So if any of you have specific things that you would like me to share with her or that you would share with Michelle that relate to mental health, I know those would be welcome. So I think that's all I have to share right now.
Any questions for Deb in regards to school, you guys? Okay, I see, so I apologize because I just see what I see in the participant name here, but I see E. Mulder.
I think my camera's on. Hi, Nikki, everybody. I am Elizabeth Mulder with ICAP. I am a community service worker. So what we have been doing lately is we just started our annual Parks and Rec voucher program for the summer. Sign up just started for that. We're giving out vouchers for $60 for income qualified students in the Brookings School District, which can be used for the pool or they can be used towards program participation in any of the summer programs for kids. We also started our garden project, which is where we're giving out vouchers for income qualified residents to buy plants and start their own garden, plants and seeds. So otherwise from that, we're still accepting and processing South Dakota Cares, emergency rental and utility assistance applications. So that is still an option for people who were affected by COVID or during COVID financially.
Now, Elizabeth, I don't know if you want to put your email address in the chat box. I'm really glad you got to join today. And so for those of you guys who haven't gotten the chance to meet Elizabeth, I'm excited she's here. But yeah, that would be great. So they have a way to help put people together with you for those vouchers and all the awesome stuff you guys are up to.
Thank you.
Yeah, thank you. Any questions for Elizabeth on some of those ICAP programs, you guys? Hey, Dr. Hunt.
Sure. We have two events coming up on April 28th. We're doing kind of an ACEs training. It's a film screening for the film Resilience, which, you know, is pretty in depth about ACEs. So that'll be, it's not online, it's just in person at the university. And I'm at that helpline training, so I'm not on my computer, but I can email that out to everyone as a reminder. And then we're just doing like promotion for Drug Take Back Day, which is April 30th, to dispose of unused medication. So I can send out some information on that too, but just to remind people, and we're gonna publish some stuff in the paper and things like that, just to educate people to get rid of those medications.
Awesome. Yeah, if you want to send that, I can make sure to send it to everybody on the list too. That'd be great. Thanks for hosting those. Any questions for Dr. Hunt, you guys? Heidi.
I am gonna click into the chat there, but it is the link that will take you to the Helpline Center dashboard. And if it worked correctly, I went in and put in Brookings County and then the crisis calls. And right now the data they're showing is from January 1 to March 31. So if you click on that, hopefully it takes you to that. If not, it's going to take you to the page and then you have to put in the different search criteria. But we've had, that just kind of shows you the crisis calls that we've had from Brookings County to the Helpline Center. And in the majority of those calls, Helpline Center staff were able to help make the safety plan. And it looks like it does not keep in the things I put in. So go to the geographies and you put in Brookings County, and then you can search and see the kind of calls that we had. And if you click on the crisis one, it'll show you that we had 18 calls during that time where they did not need to have police or intervene. They were able to take care of that with that phone call through the Helpline Center trained staff. There were less than 5 police wellness checks that were implemented from those calls as well. And then, of course, just a reminder that we do have the mental health guide out on the Helpline Center, and that is everyone, all mental health providers in Brookings County, not just the nonprofit ones, but everybody. And you can search that in a lot of different ways if you're looking for a specific type of counseling, or it shows payer sources, all of that. So again, just please help share that information out there for folks.
Wow. In 3 months, 22,527 contacts. You know, what is that like compared to other communities? I know that's a big question.
So the total contacts of that 22,000, that's going to be, I believe, all of South Dakota.
Oh, okay.
That is correct.
Gotcha.
And then when you go into your specific demographic, like Brookings County or Cottington County, you'll be able to see how many contact calls overall, and it breaks down the certain taxonomy. So rent, health, mental health, crisis.
Okay, so you have to click on the geographies tab and switch it.
Yep.
Okay, gotcha. Thank you for walking me through. You know, one question I have looking over this, and this might be a Elizabeth question, or Heidi or Tara. So the crisis, you know, rental assistance funding, those kinds of things, is that ending anytime soon? What's the kind of 411 on that program?
I believe the South Dakota Cares will be going until September. On June 1, we get our new grant, so we'll be able to help a lot more with security deposit assistance, housing assistance, things like that. But right now we are just referring people to the South Dakota Cares application process, which is run through our office for Brookings County. Little different program, but like I said, if they've had a great financial need, which it sounds like, you know, they're in that situation, they may be qualified for that assistance.
Any questions, you guys? Thanks for sharing that page, Heidi. That's really interesting. Holly.
So I'm the new community health worker at Sanford, if you weren't here last time, but There's not a lot for me, just getting in shadowing hours, getting in my certificates before I can get out and work with everyone in the community. So Heidi's been super helpful, and Nikki getting me out and being able to talk to different people at different organizations. So that's been good, but otherwise that's all.
And Holly, you can correct me if I'm wrong, but I think, right, part of your goal is just to kind of really learn a lot about the entities locally. So as you're working on referrals from Sanford, you're kind of aware. So if any of you guys want to send Holly information about your programming or services, or ever want her to come check out your space, I'm thinking, Holly, that would be good, right?
Absolutely. Yep. In any way that your services can help me to help these clients that I'm going to be having would be much appreciated.
And so our Avera will also be getting a community health worker. The hospital, Karen, you'll have to correct me, I think the hospital has 2 community health workers now.
We have just one.
Just one in the EMT department, right?
Yeah, she was an EMT previously, but her position now, she's moved to our quality department. So, yep, her name is Alyssa Olson.
Awesome. And so the Department of Health is funding these community health workers to really help with a lot of that ability to have more of that support to aid in those health related goals, as well as ensure referrals are easy to other entities. Like if I was going to work with Elizabeth for some of those ICAP needs, that community health worker can really help, if they need to go to ICAP with them or attend doctor's appointments to help with some of those specific health related goals. Really, again, just trying to utilize some of those, looking at those social determinants of health and how we can really help decrease barriers in regards to those social determinants of health. So that's what the Department of Health is really basing those on. I think what I'm most excited about, and I don't know, Karen and Holly, kind of what your thoughts are, but I think they will pair very well with the network of care with Helpline, and really being able to, again, just make referrals to community entities really flawless, as well as just, again, helping build those protective factors around our community residents. So lots of good things the Department of Health is doing.
I sent in an application for the grant application for one on Monday as well. So we'll see.
So Holly, we're glad you're here.
I'm happy to be here too, so it's great.
Jacqueline.
Yes, I'm Jacqueline. I'm the integrated health therapist here at Sanford Clinic. I don't have a lot of updates, just keeping very busy with a lot of different people coming in and having various needs. So it's great to have all these resources and make connections. But I don't know. I don't really have much updates right now.
Karen, if there's anything you'd like to add on behalf of the hospital, you're next.
Nope, nothing more from me.
Taylor.
Hello, so I'm the social worker at the Sanford Clinic. I don't really have any updates either, just been working closely with Holly and stuff and learning things from her that she's learned in the community or different things. And so I will probably continue to work very closely with her, and probably have some mutual patients and stuff. So yeah, any resources is always definitely appreciated. I work with patients in the clinic as far as different needs and stuff, and typically a lot of financial needs and stuff. So if you ever know of any anything like that that comes up, or any new things or things that have changed, I'm always definitely open to receiving more resources to pass on to patients.
Awesome. Thanks, Taylor. Kara.
Hello, everybody. I'm Tara Nelson. I'm with the Helpline Center, but specifically with the Helpline Center Network of Care. I've talked with quite a few of you guys in this meeting, so it's exciting. Some updates for the Network of Care. We have officially started expanding into the Brookings area. So we have a couple agencies currently building their network and referral platform with us. We have United Way, BCYMP, and then the Brookings Backpack Program that are going to be getting built here soon. I've also had conversations with Nikki out of Vera. I've talked with Holly, and we've also talked with LSS with their START SD program about coming into the network. So those are some like specific mental health resources that we would like those agencies to come on board. So there's better communication with seeing the services being provided, closed loop referrals, and having that community connection when you guys are referring to and from each other. If there's some agencies who want to learn more about HCNC, we're still onboarding, still meeting. You can always email me. I can put my email in the chat. We do have our first work group coming up here on Monday, which is exciting. I've been doing a lot of work for it. So we are getting community members together that are going to be the early adapters of the Network of Care. So some of the agencies who have already onboarding or are waiting to get approval to talk about what and how they see the Network of Care working for them in Brookings. So we're going to talk about what type of things you guys want to see on your general intake forms, making sure you guys are all aware that we're not sharing any kind of personal health information. The only information that is being shared is just the general, name, date of birth, general information that any other social service agency would need in order to provide services to a client. So, and then we'll be talking about a customized referral form, a social determinants of health survey that a lot of agencies are interested in having for the community. So exciting stuff there. And then on a note for overall Helpline Center, I'm really glad that Heidi brought up the dashboard that we have for our communities. A lot of agencies don't know about that. We do update that. We're a month behind. So in May, you'll be able to see the statistics and data for April. So that'll be coming up here soon. But you can check that anytime on our website. That is updated in real time monthly. And then we do have the 988 launching in July. I think a lot of you guys know that. We did get more information up on our website. So I'll send you the direct link in the chat. There's some general information, the difference between 988 and 211 call center, and kind of what that'll look like as well.
Yeah, thanks for reminding us of that switch. I appreciate that. And thanks for putting the link for the 988 info. It'll be really helpful. I kind of encourage everyone to take a look at that because that will be Heidi and I probably say everywhere we go, like call 211, call 211. So we will have to change our in regards to those mental health specific crisis calls. So I'm guessing there's kind of no wrong door as the transition happens because I know 211 is fielding those calls as they come through 988. But yeah, we will gladly learn alongside you guys as that transition happens. So thank you for reminding us of that change.
And just so you guys know too, 211, people will still be calling 211 when they're in a crisis. So all of the call center staff that are 211 will still be crisis certified. and they will be able to handle those calls effectively. 988 is also going to be kind of expanding from just what normally would be the National Suicide Prevention Lifeline. It's also going to be for connecting to counseling and things like that. And we are a statewide programs, or we are statewide. So connecting individuals from, you know, where they're living to those counseling opportunities and things like that. So there's still more that I'm learning myself that's going to be coming out here in the next few weeks. But we have onboarded staff that are dedicated to the 988 portion, and they all have their MSW in some way or fashion, and will be training. So we're going to get that started here soon. It'll be here before we know it.
Thanks, Tara. Any last questions for Tara at all, you guys?
I had one question really quick on the Connections of Care kind of database referral tracking system. I'm curious, is that going to be integrated with South Dakota Health Link? Do we know kind of any details yet?
So there's kind of two things happening. So we have the Helpline Center network of care, and that is what we're expanding into the Brookings area. There is something coming down the pipeline from the state level, the Department of Health, who also is doing the CHW grant. They have chosen Helpline to help bring about the community information exchange, which is similar to HIE, just with social service agencies. So that'll be a statewide program. And there's still being things worked out. There's still, they haven't selected a software for that yet, but they are in partner. So it's the Department of Health, the Helpline Center, and the Health Link that are in partner with that particular program.
Perfect, thanks. Yeah, it's super
welcome.
exciting. Yeah, kind of a dream of mine. So I hope it gets all working well.
Yes, there will be questions coming up. What's the difference between the community information exchange and between the Helpline Center network of care? That's something we're addressing right now. But as it is for my line of work here, the Helpline Center network of care is really dedicated to the communities and customization for that community. Whereas CIE will still be able to do the referrals for communities and be that referral outlet. There just will be not so much customization, and it won't be like a Brookings thing or a Watertown thing. So whatever they decide is the platform, that's what you kind of sign up for and get. But they're both great programs, and we're hoping that they'll be able to integrate and it'll be this big thing, but there's still a lot of discovery with that too.
Thanks,
And I'm done. You can go on, Nikki.
Thanks for always being here every month to continue to educate us. I appreciate you. On behalf of Avera Behavioral Health, I would say the big thing is if you have not heard, and Allie is still on here, I will give her props too. So the Women's Without Limits Award is tomorrow night at the Children's Museum at 5:30. And so both BCYMP and Avera Behavioral Health are up for that award, along with 3 other entities. One of the things that we're really building here at Avera is our expecting a new parent programming. And so we did complete our first round of that 0 to 2 infant caregiver play group, along with our postpartum support group we've been hosting virtually since COVID, and then getting into those baby cafes and doing some education there. And we've just seen we've heard a lot of positive feedback from new and expecting parents who are really needing that support right now. And so really trying to build that programming. So if you guys have any questions about that, the postpartum support group is still going on right now. We are doing some individualized postpartum supports also, along with the next round of infant caregiver playgroup. Start the first week in May. Registration for that is actually on the Children's Museum of South Dakota website. And then we will be starting some grief support specific to expecting parents who have possibly miscarried or lost a child. So that's just some of that new programming that we're really building the last couple years here that we just heard is really needed. And so excited to share more information about that tomorrow night. BCYMP will be there also. So it's exciting. Any other last minute business items or things you guys want to share? I know it's 12:50 and so I want to be respectful of your time. Mental Health Awareness Month coming up. Don't forget the Proclamation, May 10th, 5:30 p.m. Would love to see you at the City Council meeting. Would love to have you guys there. And we will be sending, Dr. Hunt and I will be sending some more easy social media shared mental health information that your businesses can share. So thanks for being here today, and we will see you guys in May.
Thanks, Nikki.
Yeah, thanks, Karen, for all you do.